Lukasz palka from Poland. So you'll be presenting you on occlusion in circular bridges. Dr. Lukasz palka is craniofacial department, medical university. Is working there, and last 2 years, and the 2 years experience the biomaterial and experimental surgery department. He also did his PhD in the field of restorative dentistry. And for 8 years, he's the owner of registered medical implant clinic and is an IF teacher. So here I present to you Dr. Lukasz.
Thank you very much. Good afternoon. Okay, at the beginning, I want to distinguish two things, because when we are talking about the some of the cases we are discussing there are regarding the full mouth rehabilitation, and some of the cases are the restoration. In the case of restorations, we are simply restore one or two teeth, sometimes whole segments. But basically, during this treatment, we are putting teeth in the presence of some occlusion changes, and we simply try to adjust our work to the situation which is already present in the mouth. In the case of rehabilitation, we are destroying completely the false occlusion, and we can reconstruct the new occlusion in order to get and achieve a balance in accordance to TMG and muscles. So I also want to distinguish at the beginning two differences, because there's a difference between the tooth contact when we are talking about saliva swallowing or at the end of the chewing stroke, and there is also different in occlusion when we are talking about some pathological situations like tooth clenching or bruxism. What's the difference? The main difference is that in a case of swallowing of the saliva on the foot or at the end of the chewing stroke, the most things like occlusion plane or guidance or curves of spear of Wilson actually doesn't matter. They don't matter because we can check it easily during our normal function. When we start to eating, the first thing which we are doing, actually we are opening our mouth, and then we take a bite, and then we start chewing. And during this chewing, there's no tooth contact. So in order to use, for example, the anterior guidance, first what we need to do is in the tooth contact, we need to slide the mandible into the front, and then in this case we have the separation between the teeth in the back. So actually we are not using any of the curves during normal function, and this is the main differences of which I will talk about. The most important thing in our work is the balance. This is why we are going to use those 2 points. The center, it's not working? Oh. The center of the gravity of the head. It's positioned like inside of the skull near the sella turica. And the skull have 2 main supporting points. One of the points is the muscle of the neck, and the second supporting point is the mandible, with the use of the mastication muscle and the muscles suprahyoid and infrahyoid muscles. And we can check if this is true, for example, during 2 situations. If you will fall asleep during a boring lecture, probably your head will fall down in the front of the chest. And the second thing is when you are going to yawn, your head will be positioning, will be forced into the back. So the second thing is the center of the gravity of the lower jaw of the mandible, which is positioned near to the first molar, the mesial part of the first molar. So this is the picture from Atkinson papers works, and it can explain why we are choosing and which bone we are choosing and why we are placing our implants in proper positions. Like we know, the mandible is the really dense bone which is created to absorb the forces, and the maxilla is quite soft bone which is created in order to transmit the loading